Hi, I'm Dr. Hagmeyer, and while I don't know the exact reason that you're interested in doing the Dutch hormone test, I'm pretty sure that you or a loved one is searching for reasons as to why you feel the way you do, right? You're searching for answers, and if you want to find those answers, and most importantly, a solution, I can tell you that the best way to start is with the right testing. The test I'm going to introduce you to today is not just any hormone test, but it's a special test that completes an overall understanding of hormones in a way very different than blood or saliva. What I'll say is that a test like the Dutch test will provide information that no blood test or no saliva test can provide. In many cases, especially with hormone imbalances, whether we're talking about hormonal imbalances in men or hormonal imbalances in women, testing hormones needs to often be done in a combination, meaning that not only does blood testing hormone levels is important, but also testing through saliva, but also now in urine. And in today's video, I'm going to walk you through several different scenarios where urine testing provides a distinct advantage to blood and saliva in understanding and completing the hormonal picture. What I want you to know is that, again, when we talk about hormones in blood or saliva or urine, each specimen, blood, saliva, and urine, they show something that the other specimen can't show. And if you've ever heard the expression comparing apples to apples and oranges to oranges, this is very applicable when we talk about the different testing methods when it comes to hormone testing. The nice thing about Dutch testing is that, it really rounds out the entire clinical picture when it comes to understanding and correcting symptoms that are caused by hormonal imbalances or problems that are caused by hormonal metabolism or even hormone production. If you've ever worked with a so-called bioidentical hormone specialist because you've had hormone problems, most of the time, the only testing that they are really providing is really the basic hormone tests. And so what happens next for many men and women is that they get put on hormones, and they go on these hormones for a long period of time. They go on these hormones without any kind of monitoring, sometimes for years, and their hormones become very problematic in the sense that they reach problematic levels. And that's, again, where this Dutch test can be very helpful in that it provides great information that saliva testing and blood testing can't provide when it comes to monitoring. One of the things that I think is so important for any man or woman that's struggling with hormonal imbalances is that your symptoms are not always a problem with production, okay? And what that means is that we can kind of fall into this rut of thinking that the symptoms that an individual has, again, whether male or female, it's always caused by low hormones or it's always caused by hormones, high levels of these hormones. And again, that's not always the case. Sometimes the problems are occurring, these hormonal imbalances are occurring because certain hormones are not being broken down properly. Maybe they're being broken down too quickly by the liver, or they're not being properly converted, or they're not being properly metabolized in the liver. And again, this is where testing using a urine test like the Dutch test shines. The other thing that I believe is so important is that when we talk about hormones, whether it be thyroid hormones or adrenal hormones or even our sex hormones, all of these hormones in our body, they impact one another. And when one member of the hormone family dysfunctions, we're also going to see dysfunction showing up in other members of the family. This is why that when we say, or when I say, a problem in the thyroid is never just a thyroid only problem, or an adrenal problem is never just an adrenal only problem, or a sex hormone problem is not just a sex hormone only problem. These hormones are all connected, and we call this crosstalk, like you see in this illustration here. Each one of these hormones is affecting the other. There's another reason I like the Dutch test. It shows multiple functions or multiple family members and how they function together. And again, this can only be evaluated in urine. So at this point, you may be wondering if you would benefit from an information that's obtained in a Dutch test. So let me really run through a few different scenarios in which a Dutch test will help you find answers to the problems that you're looking for. Number one, if you struggle with adrenal fatigue, maybe you're tired and run down all the time, or maybe you're having trouble sleeping. You're finding yourself, it's difficulty staying asleep or even just getting to sleep, or maybe your stress levels, you feel chronically under stress, right? Maybe you're finding changes in your mood. Maybe you're more irritable than you used to be. Testing your adrenal hormones, their rhythms, and their family members provides very specific information in terms of how to address these problems. The second scenario would be, let's say, a woman with fertility issues, or maybe a woman with polycystic ovarian syndrome. We call this PCOS. Maybe it's a woman with fibroids or a woman with endometriosis. It could also be helpful in understanding some of the more classic symptoms that's associated with PMS. Again, the Dutch test gives a complete picture of how adrenal, reproductive hormone imbalances really contribute to these symptoms. A third scenario for the Dutch test would be if you're a man, or even a woman for that matter, and you're using hormone replacement therapy. Like I mentioned earlier, it's critical to monitor your levels. And what I recommend is that patients who undergo any kind of hormone replacement, that they get tested anywhere between every 4 to 6 months. And that's to make sure that these hormones, again, are not getting out of balance. Very often what we see is hormone deficiencies looking very similar to hormone excesses, right? So in other words, low levels of hormones and the symptoms that are associated with low hormones can very often look like the symptoms of where someone is overdosed with hormones. So again, this is where the Dutch test works uniquely well. When you've been on, let's say, oral progesterone, or you've been on a patch, or you've been on pellets, or you've been on injections, or perhaps you're even taking a vaginal suppository. Another scenario where the Dutch test is really great, and this applies again to both men and women, would be an individual who struggles with sleep disorders. Again, sleep disorders can be rooted in a hormonal imbalance. Two of the hormones that can cause this sleep disruption, and again, should be tested in anyone that suffers with a sleep disorder, is melatonin and cortisol. These hormones are very important. Both of these are evaluated on the Dutch test. So again, these are scenarios that I think about. Another scenario that I think warrants a Dutch test is really anytime you want to understand more about the hormonal imbalances that are, again, related to the adrenal glands. This might be the person who has fatigue, or the person who is noticing brain fog, or the person who's noticing a loss of muscle mass or loss in bone density. It might be the person with nagging, aching, chronic, inflamed joints. Again, perhaps maybe that person has joint pain, and let's say it's not due to a direct trauma, right? This can help us understand, again, why inflammation might be tied into hormones. So again, those are all the scenarios where this Dutch test can provide information, really just some great clinical information on how to really manage and really help a person with these symptoms. One other thing I forgot to mention, and probably you've been hearing a lot about this, it's a problem that affects both men and women. It's something that I see almost every day in practice, and it's called estrogen dominance. And this is a major problem for men and women. Estrogen dominance can happen if the liver does not break down or metabolize estrogen properly. In women, this can lead to increased risks of estrogen-related cancers. This might be something like breast cancer or cervical cancer or uterine cancer. In men, it may be things like prostate cancer, colon cancer, heart disease, as well as many of the symptoms that are associated with often low testosterone, right? We call this andropause. This might be something like low libido or problems with getting or maintaining a good, strong erection. Maybe it's the man who experiences a sweating attack, right? They start feeling flush. Maybe they get nervous. Maybe they get, brain fog. Maybe they're experiencing hair loss. Maybe they're feeling more emotional than they were in the past. Again, sometimes for men, it's not just low testosterone. Maybe their testosterone levels are normal, but maybe they have elevations in estrogen. And yes, men do make estrogen. So again, testing, in such a way where we're looking at the nature and the family of all these hormones is very important. Again, these symptoms, all these symptoms that I just mentioned, can be rooted in, again, a hormone imbalance or a problem related to the metabolism of these hormones, right? So again, those are some of the scenarios where this test is very, very helpful. So now that you know what this test can help, let me explain what I like about this test. One of the things that's great is that this test is incredibly easy to perform. And the nice thing is you can do this test in the comfort of your own home. You don't need to take the day off. You don't need to go into a doctor's office. You don't need to drive into a doctor's office. You don't need to take the day off from work. You don't need to get stuck with needles. So again, these are all some of the main reasons that I really like this test. When it comes to performing the actual test, this test comes in an envelope. There's 4 or 5 strips. You take these strips, you simply dip them into your urine. You let the strips dry overnight. Then you mail those test specimens back, and within about 7 to 14 days, sometimes even sooner, we get the results back, really with any problem that might be causing your symptoms. We then contact you to review the test results in terms of what we found and can make recommendations on a treatment plan. So there you go. Hope you liked today's video and helps you understand a bit more about this Dutch test, really why we use it, who we use it with, and really why it's a great test to understand the many problems that are rooted in a hormonal imbalance. If you can relate to what I just talked about today, then I recommend that you purchase the Dutch test and consult. I'm Dr. Hagmeyer. Take care.